The TV5 News team keeps in touch with Unicell. You're in Unicell territory.
People who suffer from cataracts have the option to have a surgery, but do dogs have that same option? First News Pet Advisor Dr. Dr. Fereh is here to talk about it. Do they have that? Can you operate on dogs' eyes?
Actually, you can, and there are a number of options available for dogs that do have cataracts. Cataracts actually happen in dogs for three major reasons. One, from trauma, either from diabetes or actually old age. So they're living a lot longer now, so the cataracts, we're seeing them a lot more frequently than we did before.
So are there any outside stimulus that cause them, like people who smoke have a tendency to have cataracts more often than people who don't? Same to be said about dogs?
Not really, no.
Okay.
We think that it's either a genetic predisposition or some sort of a medical problem that's causing it.
Now, do you do the same kind of procedure that people have? You go in and you kind of chop it out and remove it and put a new one in, or?
That's actually true. They have, it's phycoemulsification is the name of the procedure, and it's exactly the same as they do in people. They do it in major institutions because the instruments are very, very expensive. There are other procedures that can be done as well. The older procedures that were used on people can still be used on animals. Now,
Caleb doesn't have cataracts, but if
That's
a dog does have cataracts, can you tell, like with people, do the eyes get all clouded over?
Okay, cataract actually is an opacity to the lens of the eye. And if you look in the eye of the dog and you see this nice black spot in the center, that's normal. But when it starts to get blue, that means that the lens is starting to become more opaque, and then you're starting to develop cataracts.
And if you wait too long, it'll become blind, that eye will.
That's right.
So let's see what those tools are.
Ah.
That one, that one makes me nervous after you told me what it is.
This is the one from last week. Oh, what do you say? You want to see it too?
Caleb, you don't want that near you, trust me.
You can. This one actually is an IV catheter that veterinarians used to carry in their shirt, and of course they had a little collar here to hold it, and this little button on the top was they took a rubber tube and they put it onto this needle, and then they put an IV IV fluids in there and ran it down.
It doesn't even look sharp as a needle as we have today. Ouch. And what's the tool for next week?
This is the instrument for next week. It was actually handmade, and it was used quite frequently in the turn of the century.
Huh, I have no clue what that's for. Caleb, do you have any idea? Nope. Thank you, Dr. Fereh. And you're going to talk about eye problems with dogs next week as well.
That's right. We have a two-part series on eyes.
All right. Well, we'll see you next week, and thanks for coming in, Caleb. You look awful nice. And when we come back, we're going to find out what was in Bugsy's safe.